Hello, everybody. Welcome. It's my great pleasure today to introduce to you two legendary women that I have the great honor and pleasure of working with on a regular basis. But if you don't know them already, I'm going to tell you a little bit about them and why their opinion matters when it comes to working with psychedelics in the application of PTSD and other complex issues that are in that category. So, of course, we're going to start with our founder, Rose Mulan Franco. Rose is a former LCDC. She's a practicing counselor that owned a successful addiction treatment outpatient center outside of Austin, Texas for 15 years. And she currently is the program director for Bodhi Academy as well as Transcendence Retreat. And she is, a legend because in my mind, anyone who is taking psychedelics before they were made illegal by the Nixon administration is someone who has a wealth of experience like she does. And so she deserves our respect, in my opinion. And Miss Sienna is also a very highly experienced underground facilitator for 15 years. She's an interfaith minister, Reverend Mother, and she is currently the lead instructor and practicum supervisor for Bodhi Academy. And she also is a manager for Transcendence Retreat. And she, of course, is an absolutely lovely woman with a wealth of wisdom, working with her community, sharing psychedelics for conscious exploration, spiritual growth, and healing. So I'm going to turn it over to them, and they're going to talk about their experience and wisdom working with PTSD.
Great. We'll be coming back to Prema at the end, and he'll tell you a little bit more about our full program. But today we're going to give you a little taste of what we teach and how we teach it by sharing with you this little brief workshop today. And hopefully it's an information-packed session for you. Let me start the slideshow for you. When it comes to healing trauma with psilocybin, it's something that I have been interested in, as Prema mentioned in the intro, since before psilocybin was banned. And it's important to note that back then, psilocybin and LSD and other psychedelics were being explored for healing a lot of different things, including addiction, primarily alcohol addiction, although there were some older studies back then on narcotic addiction. What I want to emphasize is that up to 50% of the people who are diagnosed with PTSD will also develop a substance or alcohol use disorder. So it's very common to see those two diagnoses together. When I was a counselor, I owned the Traumatic Stress Recovery Center in Austin, as Prema mentioned, and I was devoted to working with post-traumatic stress at a time when the diagnosis was really just coming online. So I have been around a long time, and having the opportunity now to come back to the psychedelics and incorporating that, it's really been a great sort of second career for me. Now I'm working as a integral consciousness coach, and I'm a certified professional coach. And Sienna and I were among the first people to get licensed in Oregon, the first legal state to be licensed facilitators for psilocybin services. And I recently became one of the first two people to get licensed in Colorado as a licensed facilitator under the Natural Medicine Act. You want to share a few words about yourself and the realm of trauma? I know you've spent years in the underground actually working with psilocybin with trauma survivors, Sienna.
Yeah, I think it's a really important body of work. And I am so grateful that we now find ourselves, as you mentioned, the research that started, in the 50s, the 60s, I think that was really informative for the underground, which I'm really grateful for because we have been doing a lot of work around trauma in the underground for a long time. And I think that those anecdotal experiences and the findings that have come from the underground have served to kind of fuel clinical trials and research. And I think there's a really beautiful symbiosis between between those worlds. And from that, we see so many incredible opportunities coming forward for people to be able to come and interact with the medicine in safe and legal settings where they can actually recover from, the extensive effects that living with PTSD or severe trauma can take on a person's life.
Absolutely. Yeah, it's great to be above ground.
It is.
And, the underground has really informed the whole of the clinical approach. We're going to dive a little bit into some of that today. We're going to first take a look at the research, psilocybin's effects on PTSD and depression, and then we'll just review the symptoms of post-traumatic stress for anyone who's not familiar with that symptomology. And then we're going to look at two different but potentially overlapping models of care that incorporate psilocybin into the healing from trauma. And so that's a clinical approach, and then more of a consciousness-based model. In our all of our work, we emphasize the realm of consciousness. I think the appropriate framework for anyone working with psilocybin or other psychedelics for healing trauma, it has to be sort of transclinical. It has to go beyond the standard realm of what how human psychology looks at the human being, and we have to encompass more of a transcendental self, and we'll talk about that coming up. Then we're going to dive into how to actually do the sessions that need to be done with people suffering from trauma who might come to you for psilocybin services or psychedelic services. So first we'll focus on cultivating the right mindset, and then we'll look at what happens during the administration session, what should you be prepared for, and most importantly, what should your client be prepared for. And then we'll look at the unique aspects of integration that are important to incorporate with trauma as well. This is just a little summary of the research on psilocybin in the treatment of trauma and depression in regards to the biochemistry and neurochemistry of psilocybin. Um, so it is a serotonin receptor agonist, and it activates all of those receptors in the brain. And these are a subtype of the serotonin receptors, specifically the 2A subtype. And those are involved in a lot of different kinds of physiological processes, including mood regulation, perception, cognition, and the actual hallucinogenic effects that take place under the influence. So psilocybin serves as a unique catalyst to psychotherapy, and it increases synaptic plasticity. We've heard a lot about the neuroplasticity effects and the healing of the neural pathways and stimulating new neural pathways that happen with psilocybin. And that is directly connected to the effects you see in people who are, gaining great progress toward their recovery with psilocybin. It reduces amygdala reactivity when emotions are happening, which is really an important effect around trauma. The amygdala is typically overactivated in PTSD, which puts people in a survival mode, especially when powerful emotions are triggered. But during a psilocybin session, those powerful emotions can come up and they're actually not so reactive and triggered and better able to look at it with a more of a neutral lens. So it increases insightfulness and introspection, which is the thing we're looking for in any kind of healing. It also increases divergent thinking and mindfulness related capabilities because it's disrupting the default mode network, which in trauma, there is a definite cycle of certain brain centers operating in sequence over and over, and the rest of the brain not connecting. And so here, that default mode network is stilled, and new areas of the brain start connecting. It can reduce avoidance of trauma because it allows the person to look at the trauma without that emotional reactivity. And it can also increase emotional empathy. The most exciting thing is that it induces these really intense emotional breakthrough experiences where people have realizations and new perspectives that they often say they didn't get in 10 or 20 years of therapy, and they get that in one day with the psilocybin. It also can resolve existential distress. We want to talk more deeply about that coming up because it can evoke existential distress as well, depending how well prepared the person is for the experience. And it can definitely increase access to traumatic memories, which is why all of the training criteria in the legal states requires facilitators to be trained in the management of trauma and traumatic memories that might come up. So there's a reference down here to a review that's published on PubMed, and you can go and look into this further by going to that link. We also have this interesting research from the Beckley Foundation and Imperial College of London around the long-term effects of psilocybin. How long does it impact people? This was their initial trial and not their full study. Later, they did a larger study, but this is a pilot that they did with 12 participants, and 67% attained remission from treatment-resistant depression and maintained that for at 1 week. There were 67%, and 49% were still in remission after 3 months. This is a really compelling study, and now it's been validated, of course, by many other studies. They were patients with moderate to severe treatment-resistant depression, and they received 2 doses of psilocybin. This is a really important thing to be aware of as a facilitator, and to make your clients aware of. People read the headlines, psilocybin resolves depression, and then they don't read the actual study, and they think they can just take psilocybin one time on their own without a container, without preparation, without integration, and they're going to get those results. But what we need to keep in mind is that all of the studies use at least 2 sessions. So they did see a significant change in the severity of their symptoms. We bring up the depression study because people with post-traumatic stress are very often suffering also long-term depression. I mean, who wouldn't be suffering long-term depression if they've been trying to get better and not finding a way to really do that? So let's talk a little bit about PTS symptoms. Just give you a quick overview. We're looking really more specifically in this workshop at CPTSD, or childhood complex post-traumatic stress disorder, that comes from trauma that occurs in childhood. So I'm going to bring Sienna in on this conversation as well, because I know you've seen a lot of folks that are, healing the childhood trauma.
Yeah. Yeah, it's true. Unfortunately, there are many people who are, suffering from various different complications that are showing up in their lives from CPTSD. And, that's sort of the the downside. The upside is that now we have an opportunity to really be able to show up and support people. And so, we're seeing a lot more people come forward. I did want to add one more thing to your point that you were making, Rose, about people getting so excited about the findings. I think it's important to keep in mind that not only are we perhaps missing the fine point where we're talking about the number of sessions, the duration of time between sessions, but another really important component of those results is all of the work that goes into the preparation and the integration that is associated with the psychedelic experience. And, that's really where the training that we're providing in the program really shows up, so that our guides and facilitators are trained to a standard to be able to help people to navigate these challenges that we're talking about, which is a really important component of getting those clinical results that people are so excited about, actually coming into remission and being symptom free.
Yeah, especially the harm reduction aspect. So we can see on this slide that there's many challenges that people with childhood trauma face, overwhelm, dissociation, to varying levels of being able to integrate or have insights around these experiences. It affects their development as well, and their self-concept and their ability to emotionally regulate. We often see emotional dysregulation. People with childhood trauma do tend to dissociate and have an acute fear response. They have trouble in relationships and interpersonal difficulties. Their trauma memories can get reactivated or triggered, which is why we have to provide a safe and supportive container for that experience. And then long-term healing has been about managing expectations, because until we enter into the more expansive realm of human consciousness where the psychedelic experience lies, there really is more of just an adjustment and maybe improved coping skills and a sense of, breaking the isolation a bit by continued therapy. And that's not a really in-depth healing. I say this as a person who had many clients with CPTSD over a 15-year period, and I didn't see the kinds of real deep transformations from that experience and really being able to reclaim their essential identity until I started working in the realm of consciousness. And of course, now with the introduction of psychedelics, we're better able to explore that realm too. So these are some of the hallmark classic symptoms of post-traumatic stress: intrusive memories, including flashbacks, nightmares, and the emotional distress that gets activated with that. Avoidance, trying to avoid reminders, trying to avoid thoughts and feelings about the experience. And that really comes from a inability to tolerate those emotions. When you grow up in the survival mode, you have to suppress a lot of emotions. So you don't learn to tolerate emotion, and you don't learn to regulate emotion either. And then negative changes in thinking and mood. So feeling like, nothing's ever going to go my way. The world is dangerous. I'm not good enough. And that instills a sense of hopelessness, diminished interest, emotional numbness, and then there's typically guilt and shame. A child doesn't really understand, why is this happening? And because they're very egocentric, they tend to look for the fault within themselves. It must be something I did, or I wasn't good enough, or my parents, couldn't love me because I'm not lovable. So it's a very painful condition. We're going to now look at some models of care incorporating psychedelics into the recovery from trauma. So first, the clinical model, remembering what we said at the top, that a lot of the aspects of the clinical model come from things that were learned in the underground. So if you're looking to incorporate psilocybin into your therapeutic practice, or maybe you're a recovery coach for trauma, you want to start with a comprehensive evaluation. You need to make sure that there are no co-occurring disorders that could be contraindicated, for example, bipolar or some of the schizoaffective, schizophrenic type of symptomology, psychotic episodes. A person may be suicidal when they have trauma. That's quite common. And so you want to make sure that they are not, that you manage that and that you deal with that appropriately before introducing psychedelics. And the comprehensive evaluation would also assess medication they might be taking and any kind of physical health issues that might come up. Informed consent is really critical for every client, and especially so with people with trauma. They have that lack of trust, the feeling of powerlessness, and informed consent is really a way for them to understand that I'm going to have this experience and I'm going to be fully informed about it, and I'm going to be, to a great extent empowered to actually navigate it directly myself. During informed consent, you want to cover physical touch. Supportive touch can be a very helpful and important part of facilitating a psychedelic journey, but it's something that can also be very triggering. So you want to be sure to carefully review appropriate physical touch and boundaries with clients ahead of time. Preparation, obviously, that's critical. That having a plan, knowing what you're going for, having even a safety plan is sometimes necessary with trauma. And education is a part of preparation as well. We don't want to just give someone a psychedelic substance without them having any idea what might happen. We want to be sure to carefully review with them the course, the typical course of a psilocybin experience, and what to expect and how to navigate some of that. We need to be in a safe and controlled environment, and that's variable, right? So for some people that can mean I want to be able to go outside, and for other people that means I want to be able to curl up in a cocoon and be wrapped in a blanket in a safe corner somewhere. um, Having trained facilitators is obviously important. There's so many variables that can happen here. You want to talk about that a bit, Sienna?
Yeah, I think it's incredibly important that that this trained facilitator piece is well established. It's essential that the person who is in the position of ensuring the safety of a person taking a journey, who is trying to navigate these complications, that person has a super exceptionally high degree of training in harm reduction, because there are so many potential challenges that could arise. Even going back to the evaluation piece, it requires a highly trained facilitator to be able to navigate what they're seeing in a comprehensive evaluation, to be able to put together a care plan, for an individual who's coming for PTSD treatment. Their care plan may be much more intricate and elaborate than a traditional kind of care and safety plan. So that training piece is really critical at every stage of the process. I really don't think it can be undervalued.
Definitely. I want to talk about the plurality of the word facilitators. There is in the clinical trials two facilitators, typically a man and a woman, but of course, who those two people might be has to be run by the client as well. They need to be able to say what feels safe for them. But co-facilitation for people with PTSD is actually the safest model to adopt. In our practice at Transcendence Retreat, we always have co-facilitators, even for one person. And because we work with trauma and addiction and other kind of issues that are complex and serious, we always want to have enough backup. There's a lot of reasons around why we would have two facilitators. the client might have a transference with one, and the other one is there to be maybe the safe person. One person can take notes, and the other person can keep an eye on the client. Um, the client might hallucinate or be having a traumatic memory of some trauma that happened to them, and they might open their eyes and attribute that to the facilitator. So the other person is there for verification around boundaries and safety. There's just a lot of reasons. It's a long sit. It could be 6 to 8 hours that you're with the client in that room, and it's really helpful to have the support of a co-facilitator. You want to be sure that you give an appropriate dosage. And, when we think about most medications, we think, well, start with a low amount, right? And certainly we would want to do that with somebody who hasn't had the experience before. But we also need to keep in mind that lower doses can increase anxiety, because we don't want it to be too low, because we don't want extra anxiety being introduced. Also, the clinical research actually shows that higher doses are more beneficial. So we're not talking about heroic doses or anything like that. We're talking about 25 to 35 milligrams of psilocin. Having the supportive presence is important. That's what you're providing as a facilitator. And there, I think it's really important to emphasize that when a person takes a full dose, a macro dose session of psilocybin, it's impossible to do therapy with them. They're intoxicated. And so we can't do counseling or therapy or coaching with anyone who's intoxicated, but we do provide harm reduction by being a supportive presence, being kind, compassionate, empathetic, having built a good bond of trust, and, just being a nurturing, compassionate presence is critical for the safety of an administration session, as well as the therapeutic benefit. The client's going to be going into the experience of the psychedelic and seeing a wide variety of things, and really having a therapeutic experience just from the medicine. When the client has come out and they're passed through the plateau stage at the end, and they're more grounded and down to earth, it's really beneficial to do just a brief initial debriefing. You know, did anything happen you want to talk about, or was there anything that was distressing or challenging for you? Just so that they get the opportunity to talk, and they might not be ready to talk, and that's okay too. But to offer that time before they depart. And then afterwards, individual integration sessions are given. They're going to be coming into a state over the next few weeks where they can start to talk more about what they experienced and start to try to find meaning from it. But group integration is also really helpful for clients with PTSD too, because they get so much from that peer support and being able to hear the experiences from other people that have the same struggles and challenges, who have had a psychedelic experience. And then you want to assess your treatment plan and adjust it, because typically the client's going to make pretty phenomenal progress in the period of time in which they're in the administration session. Do you want to add anything else to the clinical point of view?
Uh, I'll allow it. I'll just have us go forward. I think the thing that was really coming up for me when the last thing that you said about assessing and adjusting the treatment plan, and I was thinking about this on the previous slides, just, the moments that we have seen as facilitators where these transformations start to occur for clients is so phenomenal. So when you said assess and adjust the treatment plan, it made me think of so many people that we have seen together, who arrive in a state of struggle with their condition, who progress throughout their experience, and their treatment plan changes and things change. And it's just such an incredible gift that I got swept away on that thought.
It is amazing to get to witness these kinds of transformations for sure. But it's also, be mindful to tune in how they're doing with their integration. And if it's time for another administration session, that can be helpful as well. From the depth coaching and consciousness point of view, of course, we're going to do all those things we talked about. We're going to do the evaluation and the preparation, but we do different things in the preparation process with people with PTSD. So dialogue and inquiry is one of the hallmarks of depth coaching, where we just have a conversation with the client, about your intentions and why you want to do this, and what are your expectations, and what are your hopes and fears, and have them inquire, more deeply, to be sure that they're really setting truly meaningful intention. And then we usually introduce preparation methods that they should practice ahead of the session, like mindfulness and meditation, personal journaling, and we do teach a variety of different breathing exercises and grounding exercises, and we want them to be very familiar with that before they arrive for the administration session, so that if they need it during the administration session, they remember it and they're able to do it. We also spend a lot of time in our preparation process from the consciousness model, providing psychoeducation about the transcendental self, or the inner healing intelligence, or the inner healer, or the greater self, or the higher self, however you want to call it. But it is really an important concept to introduce to people with trauma. They so often get identified with their diagnoses, and will say, I'm a survivor, or I'm a victim. And that's not who you are. That's something that happened to you. So we talk a lot about that, and teach them, the whole theory of the transcendental level of human awareness. Setting meaningful intentions, this is always important. It's a part of harm reduction. It's shown in a lot of the research. I always think of the article by Robert Carhart Harris and his team called Psychedelics and the Essential Importance of Context. And he discusses in that article how critical it is that people have purposeful and meaningful intentions, that they're not just going in there and saying, let's just see what happens, because you don't get the same therapeutic benefit, and it leads to harm if it increases the risk of harm if people don't have a purpose. We create ceremony as well as the supportive presence. So we have a ceremonial medicine person who is involved in the session, who makes a personal ceremony for the client. And it doesn't have to be spiritual or according to any tradition. This would be something the client would have input into, and would speak to their preferences as well. Afterwards, we go more deeply into interpretation of symbols in the psychedelic experience, any dreams that they have had since the experience. We offer creative expression, which could be movement, it could be chanting, it could be singing, it could be art or painting. And we offer a variety of integration exercises, including integration games and coaching games. And we take a very holistic approach. So we're looking at the whole person. What was your somatic experience? What was your mental experience, emotional experience, your spiritual experience, or higher consciousness perspective?
I want to just add something here, that the intersection between those two, bringing the clinical approach and these consciousness and coaching approaches together, is really it's such an amazing amalgamation, where in my opinion the results are so radically amplified, and the timeline is so accelerated by bringing these two paths together. It's really just such a beautiful synergy to apply both models and create something as remarkable as as we have an opportunity to have created. So I just wanted to add that piece in.
Yeah, and these are things that I have to say consciousness is a foundation of all the work we do and how we teach and how we train, but we don't leave out the clinical. So incorporating these things together and merging them together is can be a really beneficial approach and a really productive approach as well. Cultivating the right mindset ahead of time is really important. We do talk a lot about mindset, set and setting. When we say set and setting, the set is the mindset of the client. Obviously, clients who have PTSD have unique challenges with mindset. They can be over controlling, more fearful, more avoidant, more trust damaged, more resistant, more anxiety. They can be attached to that diagnosis identity. I've always been this way, and so this is who I am. They might have co-occurring disorders or substance use issues. They might be on psychiatric medications, and they certainly often have boundary issues. So providing a thorough screening, maintaining unconditional positive regard, and creating a strong alliance. So we're talking about safety, trust, attunement, mindfulness around boundaries. Be sure and explain and receive informed consent. Talk about supportive touch and secure their consent, and talk about how they can indicate they don't want you to touch their hand or their shoulder during the session. We're going to empower the client to advocate for their own needs, which may be a new thing for them and may take additional preparation time. We want to be sure they have preparation education so that they don't get surprised by something happening in the psychedelic experience. We use a variety of assessment and coaching tools, and we teach our students those tools as well. So we have a self-care evaluation, a boundaries tool, values assessment, and exploration of that inner self, that transcendental self. Make sure the preparation is comprehensive. So you talk about ahead of time boundaries, how we're going to manage that, what triggers might happen, potential emotional escalations, and how that will be addressed during the session. They may need additional navigation tools because of all these tendencies they have, and fine tuning their intentions to make sure that they're really going deep and they're really getting what they need. Making sure the client practices surrender before they actually get to the session. There's a lot of tools and techniques for that, and that you need to understand the challenges around trust and take time to build a bond with the client. During administration, you're going to really have to call on your facilitation skills, because you're going to need to be able to prevent or manage overwhelm and dissociation, help them navigate anxiety and resistance, provide education, remind them about the navigation skills that you taught them ahead of time, and mindfully and carefully employ or refrain from supportive touch. It wouldn't be uncommon that you would have to manage psychological distress. We do have a lot of content in our training on this topic. Intervene in emotional distress early. Plan to have a co-facilitator. It's also can be helpful to have a backup facilitator on call. We've had that happen with one client, that they have a co-facilitators, but they come into a state of very high emotional escalation. It becomes physical. They're getting up and moving around, and having that backup person is really been a good safety measure. Provide reassurance, embodied presence, a calm demeanor. Use supportive touch only if it's appropriate, only usually if you ask first, and then allow silence. Even if psychological distress is happening, know that time will pass, things will change. Don't react to distress with distress. Stay calm, watch the clock. You know that the session is going to end in a specific time frame. The right setting is really important. Eliminate triggers. You want to mention a few of those, Sienna? I know we talk about trauma-informed settings, and so we really kind of go in there with an investigator's mind.
Yeah, it's true. We have to be really mindful, especially with sensitive demographics and sensitive clients. We have to be really, really mindful of potential triggers in the space. And those can be decorative objects, they could be book titles, they could be, different environmental considerations that we may want to make sure are in place. For example, we may want to ensure that the location isn't going to have a lot of foot traffic, a lot of noise pollution, sirens in the background. We want to make sure that we're creating a safe and nurturing, comfortable environment. And as Rose mentioned earlier, that can look really different for different individuals. As she mentioned, one person may want access to be able to come and go from inside to outside, and that may be a safety measure, whereas another, as Rose mentioned, may want to be cocooned and cozy. So we really need to explore that with each individual during the preparation process, and elevate our standards when we are serving, certain demographics, to really ensure that we take extra precautions with the setting, and are really mindful of all of these potential environmental contributors.
Yeah, and it's helpful to have the client bring some objects that represent their intentions and put them in a focal point. You can call it a focal point, you can call it an altar, but it's a place where they have objects that really represent why they're there and what they want and what they need. And it can include anything that they want, objects from nature, or whatever they like. And we also invite them to bring comfort items if they have a certain pillow or blanket, or often they might bring a stuffed animal, but just to, have something familiar and comfortable and comforting with them as well. The noise pollution is critical. We're seeing a lot of healing centers and licensed service centers happening in urban areas. The lighting can be bad. The environment can be tight and closed in, and that can feel difficult for the client. And having sirens go by is really distressing in a lot of ways, to see how the legal system has approached these very important environmental considerations, and they haven't really thought it through, in my view. And some of these things can really trigger additional psychological distress for these clients. So be mindful where you're going to conduct the session, and make sure that it's trauma informed. Afterwards, the client's going to need support for integration. You want to make sure that they have an accessible safety plan that they design. It has to come from them so that they will be able to use it. They need to identify when they need additional support and what they will do to attain additional support. You want to go back to the methods you taught in preparation for managing anxiety afterwards, and make sure they have a clearly defined support system, and they know how to implement it and when to implement it. We like to make a holistic self-care plan. How will you integrate somatically? Maybe you'll do yoga, maybe you'll get massage or somatic therapy. How will you integrate emotionally? They can incorporate art, movement, nutrition. There's so many areas that we talk about, in the whole training. Having a well-structured but flexible integration plan, because things can change as they process through the experience, and then encouraging them to undertake practices independently. Go to that yoga class, go to that meditation class, or set up a daily discipline for yourself. It can be very important to work with an interdisciplinary team for integration. So having a coach, having a peer supporter, having a acupuncturist, a massage therapist, a personal trainer, as well as a therapist. We like to have all of them on our team, and building a good referral network, so that if something is happening that you're not qualified to handle. Perhaps they have HPPD, hallucinogen perception persisting disorder, or they might be having flashbacks. And if you are not well trained in that, you would want to refer them to someone who could help. Maybe they have a spiritual situation, or they had an inter-psychic transmission in a group setting. You want to be sure that you have a well-rounded referral network to support all kinds of needs. You want to provide tools and use tools to help evaluate their progress with integration. And then we go to depth coaching. We really like to support people to deeply heal themselves and to have the power of healing in their own hands. So we provide a lot of tools for that depth coaching process. We might recommend that they undertake a microdose protocol to maintain their progress after a couple of initial full dose administration sessions. They might need to be referred for counseling if they weren't already in counseling. So keep that in mind. And then you want to assess and plan, will they need additional administration sessions? And, you know, some of the talk in the field now, based on the clinical studies and how things are playing out, they're saying that a course of psilocybin treatment might look like one session a month for 12 months. I think that's reasonable because it's being incorporated with other methods of self-exploration and self-empowerment and self-healing. And it's things are going to change and new things are going to come up. And it's good to know that, you know, you can always go back to a psychedelic session and go to that next level, take the next step. What are your thoughts on integration for PTSD?
Oh, well, my thoughts on integration in general is that, you know, that's where the opportunity for radical transformation really lies, you know, and that's where clients are not only going to have an opportunity to integrate the experience that they had and figure out, you know, how did their experience correlate to their intentions, but they're also going to be in a much better position to understand themselves more deeply, understand what kinds of support they need going forward, and how to put those support structures in place. And it's really an incredible process. You know, I agree with you as well. I wanted to just mention that last point that you made, which is that, you know, it is really critically important, going back to the training, that facilitators who are treating clients who have these more complex presentations are trained to an extremely high and rigorous standard for all of the different safety considerations, harm reduction considerations, long-term outcome considerations, to ensure that that safety piece is there all along, including the last point you made, which is being able to make an assessment and plan a treatment plan that is individual and unique to the client and the presentation sitting before you. And frankly, you know, it's difficult to do just as one highly trained person, which, you know, takes me back to your other point about having an interdisciplinary team and a referral network. And if we're in this work and we're doing this work, you know, we need to be very deeply committed to our training and the training of the professionals that we lean on for support and navigating, you know, whatever presentations might be coming forward.
Yeah, absolutely. Well, this was a brief overview, and we want to thank you for being with us, and you know, invite you to explore more about our program. And you know, we're grateful that we had the time to talk about this important topic with you today, and we hope that you'll join us and learn more.
Thank you so much, Rose and Sienna. I feel that that's valuable information, whether or not somebody decides to train with us. But I'm going to tell you all about the training that we offer, because it is certainly our passion and our great honor to be able to share this training in depth with those who are seeking to engage it. So I'm going to put a couple links here in the chat. This is our homepage and our course schedule. And bodhi-academy.com and bodhi-academy.com/schedule. And so we've been extremely pleased recently to have individuals in the community, other professionals and colleagues, come to us and tell us that we are now garnering a reputation as being the gold standard in psychedelic facilitation training. So that was unsolicited feedback that we received recently, and it really made everything. I mean, it was so great because we strive for that, and I'm glad others are perceiving that. And our program really merits that. It's a 6-month program, and it has over 370 hours of content and training. And so I'm going to tell you what's nested within that. We have 125 hours of video training, and inside of that, the topics include evidence-based harm reduction methods, clinical and indigenous practices, coaching skills, and tools for depth work. And as you know, Rose is an integral consciousness master coach, and she's been practicing for a long time. And she's really, as the title indicates, she's actually a master of the coaching method. So it's quite a blessing to be able to learn her approach and methodology for coaching, which I'm just going on a tangent here and telling you that coaching is, in my opinion, and in our opinion, one of the most valuable and effective tools for incorporating with psychedelic facilitation. And during the course, you're going to learn how to do that, the whys and the hows. And I think that's extremely valuable. And so the integral consciousness coaching is not all about, it has nothing to do with Ken Wilber, by the way, and his integral consciousness. It's totally separate. So the integral consciousness theory that we work with, is its own methodology, and it's very much a cornerstone of our work. And so we also have 96 hours of live synchronous training. Within that, there's going to be 4 role-playing practice intensives, which the feedback from the students are always that the practice intensives are extremely valuable for obvious reasons. Then we have the pinnacle, the peak experience, the 100-hour practicum training, which this year is going to be in the mountains of and last year's cohort had absolute practicum training retreat. And I really am looking forward all week now to get to the practicum training again. It is really truly the gem of our program. Just so you know, if you go and do your homework, you're going to find that most programs do not have a 100-hour practicum training. We go above and beyond. And not only is the practicum training above and beyond, but as I tell people, you are going to learn things in this program that you won't find in any other program, I promise you. And I would love to talk more about that. If you get into the program, you'll start to see what are those areas. And then on top of that, there's 50 hours of consultation, supervision, and mentoring. And that's special because, as we've been sharing recently with other people, the cohort is small by intention. Some of the training programs out there have very large cohorts. You're going to get a tremendous amount of hands-on tailored instruction, and the intimate cohort is a higher quality of learning. So we also have curated an incredible collection of academic and clinical research papers. So you're going to get total access to those. And perhaps one of the most valuable pieces is you're going to get set up with a complete suite of client forms to launch your practice. So you don't really have to do anything. You can take these straight away and plug them right in to what you're doing. And it's a huge time saver and a great boon. And then the final thing is, after you complete the 6 months, you're going to include it in your fee will be a 1-year membership to our guide community, the Guides Collective. And we meet monthly. We have a signal group, and it is so great to have the students with us on an ongoing basis. I'm sure you'll see the value in that. It's essentially like continuing the training, and the live Zooms every month are incredibly rich with learning experiences. So the learning goes on, and it's kind of like continuing in an apprenticeship. So if you have any questions about what I just shared, you're curious or you want to learn more, we have 3 more information sessions this month before we close enrollment in about 3 weeks. So I'm going to put the link here. You can find it on Eventbrite. It is Bodhi Academy information session on Eventbrite, but there's the link for it. And I think this is one of the coolest things that you don't get either with other programs. If you want to know more about what we're doing and you want to talk to Rose, she's giving complimentary free consultations one-on-one, and she gives a lot of time, and you can ask any question you have directly to her, and she's going to give you phenomenal answers and a lot of care that's worth money, in my opinion, just to get on these one-on-one calls. So they're free on Calendly. Here's the link for her Calendly. And our training, as I've been telling you, is considered the gold standard. And our community of practitioners, which has included physicians, medical doctors, nurse practitioners, advanced nurse practitioners, different types of nurses, clinical therapists and counselors, trained coaches, holistic wellness practitioners and clinicians, and consciousness specialists, such as those who are immersed in yoga traditions, who are yoga and meditation traditions, and other natural medicine lineage holders and practitioners. All those types of practitioners are in our cohorts, as well as you see that reflected in our faculty. And you know, we're looking for certain types of individuals. We're looking for people who have ideally 3 to 5 years of experience in healing arts disciplines. We're looking for people essentially, you know, who have pursued professional credentials or licensing of some kind. And the reason for that is, you know, we want people who know how to hold appropriate boundaries and have some experience already holding space for healing, personal growth, and conscious awakening. So if you have any question about those criteria and you're wondering if you meet them or not, just hop on a call with us. You can email us at bodhi@casedavis.com. Go on the website, fill out the contact form. And also you can join our email list on the website and keep up to date with what we're doing. So yeah, those who have some type of, you know, ilk or orientation towards understanding that this is serious work and it's extremely fulfilling, perhaps some of the most fulfilling work you'll ever do. I mean, at least I feel that way, and our faculty feels that way. And so we want to make sure that our cohorts are serious people who are ready to take on that responsibility. And if you're that person and you feel the call, then we welcome you to our future cohorts. And so if you enroll or if you apply and fill out the enrollment application, we'll get back to you within 10 days. So just know that if you fill that out, you definitely will get a response. We'll review it and let you know our input. And so finally, our next session, as I mentioned before, we're doing information sessions every Wednesday, 3 more until the end of the month. So Wednesday, February 12th, we will be hosting our faculty member, Rachel Doherty. And Rachel Doherty is a long time old friend of ours, going back to when we lived in Crestone, Colorado. And she is a certified sound therapist and one of the most elite, if not the most elite, sound therapy methods in the world. And she'll get to tell you about that. She specializes in sound and music for psychedelic work. So we'll also have another of our program graduates with us for that information session. So hopefully you'll get to join us and hear firsthand from a different student that we haven't heard from yet, how the program was in their experience. So that's it for now. I'm so glad we get to do this together. I truly, truly feel like the slides and the content, everything that we talked about here, you could just take that and you know, if you're if you already are a practitioner, I think you'll probably get some value from that as a standalone. I think today's call stands on its own. So I hope you see that value, and I'm very pleased to have been sharing in this experience with you today. Thank you, Rose and Sienna, to our guests, and we'll see you on the other side.
Thank you, Prema. Thanks, Sienna. And thanks to everyone for watching. I hope to see you at an information session or jump on a call with me soon.
Bye.